This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
Morning, everyone. My name is Nathan Conrad with Platform Communications. I'm going to be your moderator on today's press conference. We have quite a large amount of reporters on the call. What I'd like you all to be able to follow on directions here in order to get this set up in an orderly fashion. Once we get to the end of speaking announcements and we open the question and answer, we will be utilizing the chat function. So please, in the chat function, go in. The messages will come to myself, the host. State your name and your outlet. I don't need to know what your question is. We will be answering questions in order on the queue that comes to me. I will unmute your line. It can take up to 3 seconds for your line to fully unmute. Once that line has been unmuted, please ask your question. Direct the question as to which member of this coalition you would like to speak with or have an answer from, and they will, at that point, I will unmute their line. They will be able to answer your question, and we will continue in this format until we get through the questions or run out of time. So with that, I would like to hand this over to Eric Borgerding from the Wisconsin Hospital Association. Thank you very much.
Thank you. Good morning, everyone. I'm Eric Borgerding, President and CEO of the Wisconsin Hospital Association. Thank you for joining us this morning as we announce a unique and urgent new coalition, Stop the COVID Spread. As much as we welcome opportunities to partner with fellow Wisconsin associations and leaders, I wish we weren't here today, but we must be. And it's because Wisconsin is in a troubling and worsening place when it comes to COVID, a situation we need to take seriously and work together to turn around. The condition of our pandemic is visible in the alarming increase in COVID infections. And for the past month, daily new records in COVID hospitalizations, reaching the 900 mark yesterday, tripling in the last 30 days, and so far showing no sign of slowing down. The direct and indirect impacts of COVID spread in our communities are increasingly stressing parts of our outstanding healthcare system, weighing down local health departments, and continuing to challenge our healthcare heroes, those nurses, custodians, doctors, technicians, and many others who keep working long hours behind masks, behind face shields, in gowns and gloves to keep Wisconsin's great healthcare accessible and safe. The impact of Wisconsin's growing situation is most visible in healthcare, a sector that touches all of our lives and all of our industries. But COVID goes beyond healthcare. And it's why we are joining with colleagues to launch Stop the COVID Spread, a collaboration of nearly 25 business, local government, and higher education organizations banding together and taking steps to help combat COVID, including urging the public to take COVID seriously and be diligent about things like hand washing, social distancing, and wearing a mask. Mobilizing the membership of each of our organizations to stay committed to implementing safe practices in our workplaces and industries, and encouraging the same outside the workplace. And launching a wide range of advertising to educate the public about COVID and what they can do to keep themselves, their families, and their communities healthy. This diverse, and I predict growing group, rapidly came together. And even more impressive, it's a coalition representing the gamut of industries across Wisconsin. Restaurants, realtors, grocers, gas stations, manufacturers, the State Chamber of Commerce, tech companies, telecommunications, county and municipal governments, banks, builders, the University of Wisconsin system, and of course, healthcare. These are some of Wisconsin's most influential organizations, now aiming that influence at COVID and working together to slow down this spread and turn it around. Thanks again for being here, and I'll now introduce Brandon Scholes, President and CEO of the Wisconsin Grocers Association and a fellow co-chair of Stop the COVID Spread. Brandon?
Brandon, I'm going to ask you to pause for 1 second. We're having a technical difficulty on getting you unmuted. There we go. I'm sorry, Brandon. Here you go.
Great. Thanks, Eric. We are pleased to be a part of this group, but it's kind of bittersweet. We're pleased to be a part of it, but we wish we didn't have to. That being said, we're all faced with the challenges of what we need to do collectively to help stop the spread of this dangerous disease. Back in March, the Wisconsin Grocers Association ran a short story in its newsletter that said, on March 6th, the Campbell's Soup Company was increasing production to meet the demands from the expected upcoming pandemic. We had no idea what that would mean. We couldn't even fathom what would happen to our industry and those of the folks that are around the table. But what we did know was that as grocers, our members have been committed since they opened their stores to cleaning and sanitizing their facilities and making it safe. But when the pandemic hit, they took that to another level. They upped their game significantly to make sure that the people that were coming into their stores, their customers, as well as their employees who had no idea they were going to spend months facing these challenges, they took the steps to make sure that their stores were clean, that they were safe, that they were sanitized, and they did everything that they possibly could. We hope that with this coalition and the message that we send, that others around the state will take us up on the challenge to do the same, whether it's personally in their homes, in their businesses, or in their daily lives. Take the simplest of efforts to take those steps to sanitize, to make sure that you treat others the same way you would like to be treated, to make sure that those essential workers in businesses across the state are kept safe. As I said at the beginning, we're pleased to be a part of this. We'll do everything we can through our members across the state and try and continue to send that message. And Eric, thank you. And for the rest of the folks in this group, we're glad to be a part of it. And now I'd like to turn the microphone over to Kurt Bauer, President and CEO of Wisconsin Manufacturers and Commerce.
Thank you, Brandon. Good morning, everyone. WMC, along with our Wisconsin Safety Council, which is a division of WMC, has worked from the beginning to make sure that our employers have been taking the necessary steps to keep people safe at the workplace. And I think that they've done an extraordinary job on that fact. And one of the things that we've been working on in the last couple of weeks is asking our business leaders to become community leaders and making sure that they are communicating and emphasizing to their employees to take the same precautions at home and at play that they have been at work in order to protect themselves, to protect their loved ones, to protect their coworkers, and of course to protect their communities. So we need everybody to step up. We need everyone to continue to be diligent. What I like to say is that many of us are done with COVID-19. Unfortunately, the pandemic is not done with us, and we have to do this for the long haul. So WMC is very pleased to collaborate with the partners on this call. We've been in constant communication over the previous weeks, talking about the spread, talking about the situation, and working together for solutions. So WMC is very pleased to be a part of this. And now it's my honor to turn the call over to Kristine Hilner, who is President and CEO of the Wisconsin Restaurant Association.
Thank you, Kurt. As Kurt mentioned, my name is Kristine Hillmer. I'm the President and CEO of the Wisconsin Restaurant Association. We too wish we did not have to be part of this coalition, but really proud to lend the voice and the support to restaurants to help this initiative. Since March, restaurants have put together safety plans to keep their employees and their customers safe. These protocols have been established according to the best practices established by the Center for Disease Control, Food and Drug Administration, and food safety experts from around the country. Restaurateurs are doing their part, and I urge everybody to honor and follow the protocols as set in place and to help the spread of COVID in our state. It is a two-way street. The protocol set in place at a business is only as good as how they are followed, both by the business and those who patronize the business. Only by working together will we slow down the spread we are currently seeing and that are affecting so many of our fellow Wisconsinites. We all understand that this is not always easy or comfortable and that the individualism in Wisconsin is alive and well. But for the health and wellness of Wisconsin citizens and the survival of business, including independent and family-owned restaurants, working together is more important than ever to beat the spread. It's now my honor to introduce Mark O'Connell, President and CEO of the Wisconsin Counties Association.
Thank you, Kristine. As Kristine indicated, I'm Mark O'Connell of the Wisconsin Counties Association, and I'm proud to be a member of this coalition of what are really the most respected organizations within our borders. Every member of this coalition cares deeply about the citizens of our great state. We also care deeply about the future success of Wisconsin and the opportunities that we believe every Wisconsinite should have available to them. And that is why we must successfully address COVID-19. We have some of the greatest minds in our nation working around the clock to develop a pharmaceutical solution to COVID-19. And we are all very hopeful that they will be successful. But until that success arrives, there is something we can do on our own right now, right here in Wisconsin. We can wear a mask. We can wash our hands. We can socially distance. These are not hard things. We ask that you do this not only for the today, here and now, but for the future of Wisconsin. It is now my pleasure to turn the microphone over to the Chief Medical Officer of the Wisconsin Hospital Association, Dr. Mark Kaufman.
Thank you, Mark, and good morning. Unfortunately, Wisconsin is one of the hottest of all the COVID hotspots in the United States. We trail only California and Texas in the number of new cases in the last 7 days, despite our population being much smaller than both those states. Wisconsin's current 7-day average of new cases is 5 times higher than our spring peak last May. Over 140,000 of our fellow citizens have been diagnosed with COVID-19 in Wisconsin, and more than 1,400 have died from this disease. Just yesterday, in the Badger State, unfortunately, we recorded a number of record highs. A record high in the number of new cases, 3,132. We have never before had a daily case rate of greater than 3,000. A record for the number of hospitalized COVID patients, 907. 3 weeks ago, that was 342. And a record number of 228 COVID patients in Wisconsin hospital ICUs. All geographic regions are experiencing record or near record numbers of hospitalized COVID patients. Many Wisconsin hospitals are operating at or near capacity, peak capacity, having activated previously developed contingency plans. In some regions, patients and staff are being transferred to best match patient needs to hospital resources. We need to slow the pandemic, and it is in our power to do so. We must focus on the science and on ourselves. Wear a mask, physically distance, wash hands frequently, and get tested for COVID if symptomatic. We know what works. We just need to do it. That is why our state's leading advocacy organizations joining together to form the Stop the COVID Spread Coalition is so crucial. We all need to work together to combat this public health crisis. And now I'd like to turn it back to our moderator.
Thank you very much, Dr. Kaufman. Again, we are open for Q&A. Just to keep everybody set up here, we will be discussing the coalition and our efforts to combat the current public health crisis. Any questions that veer from that topic, we will do as a follow-up. I will provide information at the end as to who to contact for follow-up questions, as well as provide the press release with a little bit more information as well. So as it is right now, we do not have a ton of questions in. Hold on one second as I begin to pull up. Our first question is from Emily Davies at WSAW. Emily, give me 1 second to get you unmuted. Go ahead, Emily.
Hi, thanks for holding this. My question is, a lot of your organizations represent a lot of different people. We've seen those various businesses that fall under your different agencies or, associations that aren't taking this seriously. We have individuals that are still holding mass gatherings, talking about herd immunity. What will it take to get those individuals, those businesses to take all of this seriously? And what is the importance of having that happen?
Emily, this is Nathan. Who would you like that directed at?
I guess this would be for really anyone, any of the associations or obviously the hospitals we've talked about it. So I guess any of the business associations.
Okay, Eric, we're going to go ahead and unmute you.
Well, I think That's really getting at the heart of what this coalition is about. Obviously, the WHA represents all the hospitals and health systems in Wisconsin, sort of seeing some of the effects of the spread of COVID. But one of the primary reasons we pulled this coalition together was to speak with a very loud and unified voice to all of Wisconsin, to our members of our public, to our businesses, to our organizations, and through our organizations, really to encourage them to take COVID seriously and start really diligently adhering to these really simple precautions. That's our respective organizations, not just on this screen, but the 25 total members so far of this coalition have a pretty loud voice and a pretty broad reach. And that is one of the roles of this group, is to speak not only to the public, but to our own constituencies within our organizations and our associations.
Thank you. Our next question comes from WBAY. Hold on, Joshua, I'm going to unmute your line.
Hello. Thank you both for thank you everyone for holding this call. My question is directed at Dr. Kaufman and Mr. Borgerding. In regards to elective surgeries, would you recommend that people have elective surgeries now with the rising cases of COVID-19 in the state? And is there any sort of discussion on the way on whether to stop or put a pause in elective surgeries? I know yesterday someone at Bellin Health made the comment about they're looking at possibly stopping elective surgeries, and I wanted to hear what the recommendation is.
I think I can start with that one. First of all, hospitals are among the safest places to be and to be present in terms of COVID-19 transmission. So they are experts and have core expertise in infection control, cleansing, and that is just what they do really well. But with respect to elective surgeries, it really depends upon the local hospitals. Hospitals are always looking at planned procedures, elective surgeries, at bed capacity, at healthcare workforce status. And because of the surge of inpatients in the last few weeks especially, hospitals have activated their contingency plans. And part of that is multiple times a day looking at planned procedures, looking at staff capacity, and looking at beds. And to the degree that it makes sense to postpone elective surgeries because of emergencies, either for COVID patients or non-COVID patients, they are managing those multiple times a day. But if your hospital tells you they have room for your elective surgery, it is definitely safe to have that surgery.
Eric, would you like to further respond to that?
No, that's an excellent answer and spot on.
Our next question is from Kia Murray at WLUK.
Hi, this question is for Dr. Kaufman. When we talk about the record numbers of coronavirus cases, they're either equal to or even higher than what we saw when the pandemic started. So my question is, with this new wave of coronavirus cases and historic highs when it comes to hospitalizations, what are the new issues that you're seeing from area hospitals?
The biggest and most pressing issues for area hospitals has to do with the status of the healthcare workforce, with their bed capacity, and when it's necessary, having to match all patient needs, COVID and non-COVID, with hospital resources. The good news is that all hospitals have contingency plans. There has been a level of collaboration, data sharing, and cooperation among Wisconsin hospitals that in my 40 years in healthcare in Wisconsin is unprecedented. People talking within systems about how best to take care of patients, people talking across systems that might normally compete with each other from a business perspective, collaborating, discussing how best to take care of all the healthcare needs of Wisconsin citizens.
And then would I be able to ask just a quick follow-up?
Very quickly.
We're wondering the impact then too with nursing homes. I mean, what is the relationship between nursing homes and hospitals and how has that changed with the increase in coronavirus cases?
So the ability of hospitals to have timely discharges and transfers to long-term care facilities when patients are medically ready impacts the hospital's ability to accept new patients. Because of public health guidance and issues related to COVID, public health, hospitals, and nursing homes are working through the issues to try and facilitate the most timely discharge possible of patients, inpatients in the hospital medically ready for discharge, and nursing homes being able to accept them in a safe manner with respect to COVID-19. Those discussions are ongoing and evolving.
Next, we have Amelia Jones from NBC 15. Remember, please let us know who you'd like to have the question asked to.
Hi, I apologize. I can turn on my video. Oh, I just turned it off. I'm sorry, guys. Hello. My question is for Kristine Hillmer. And Kristine, we know that Badger football is about to start back up. And so specifically for here in Madison, we just obviously had that statewide order with 25% capacity. How are you expecting the restaurant industry to go along with that? And are they going to see a bigger hit than what they've already seen?
Well, I think that the broader question is how the customer and consumer can support a restaurant who's trying to survive. And I certainly encourage folks to dine out. Even at the 25% capacity, many restaurants have seats that you can go to. And again, with the safety protocols, it is safe to go out to eat. Beyond that, I certainly encourage to do curbside, to do things that supports the restaurant in other ways. I think that's the broader question. We want these restaurants to be around, but we also know that the safety protocols must be followed, and that we want everybody to stop the spread and do their part in this. And restaurants will do their part. And even if it's delivery, call the restaurant to figure out the best way to get the food. That's the only way we're going to get through this, is follow the safety protocols and support the businesses, whether it's a restaurant or whether it's a convenience store or a grocery store or wherever. Support these local businesses, because that's part of the economic health that's so important for our state.
And with our last question, we have Jason Calvi from Fox 6 in Milwaukee. I apologize, I'm trying to unmute his line. Give me 1 second, folks.
Sorry about that, Jason here. Can you talk about the mask mandate? And we've seen the numbers, going up. They continue to go up. So, how has the mask mandate? Has it helped? Has it not helped? This is all sort of uncharted territory. But just wondering if I can get an answer to that question. Thank you.
Jason, who would you like that directed at?
Sorry, I keep fighting this mute button here. Anyone from the Hospital Association or anyone else who would like to chime in on that?
Fantastic. We'll start with Eric. Hold on 1 second.
Good. What we know is that masks work, and whether it's through a mandate or through very vigilant use and encouragement of using masks, we know that it works. And that is one of the primary reasons this coalition, this broad coalition, has been formed. And that is to really double down on our messaging and urging of the public to take these important steps, including wearing a mask in public. Whether it's a legislative or an issue that's in the courts, those things are going to play out. That's really not what our coalition is about right now. Our coalition is about making sure that the public understands how serious this really is. And secondly, that they diligently adhere to those safety protocols, regardless of how they are implemented.
Thank you for that response, Eric. Everyone, we are running up quickly on the deadline for the end of this call. I am sending you all through the chat function the email address of Miranda Tannick, who will be able to sort your further inquiries. We do understand that there are a lot of other questions. I have also included the link to the Stop the COVID Spread piece so that individuals will have an opportunity to see the full press release. Again, thank you very much for your time and attention. I do realize there are a lot of questions in the queue, but we will be able to get to them through follow-up. Thank you very much for your time. Oh.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.